What you're going to see in this video is an interview that I do at a battered women's shelter. And Melissa will be role-playing a woman who comes into the shelter having just been beaten up by her husband. And we find out very quickly that she's been already 6 or 7 times to the shelter. And I'll take a history of what's going on currently. I'll comment on her body language, her behavior very early on in the session. So from a short-term dynamic psychotherapy perspective, I'm doing a very quick analysis of transference. So you can see that it looks like kind of a common sense advice-based type session with some education, but there's a lot of dynamic principles going on at the same time. And it's clearly being done from a system perspective because there's a husband and a wife and kids and we're at a shelter. You'll see that the mini version of the problem of attachment to the perpetrator crops up right away. And then I start to flesh that in by looking at the current problem with the battering husband, back to the past where the problem of attachment to the perpetrator with the raging alcoholic father got started. Then I'll try and compare the two. You'll see that she's not too happy about that. And then I start working on explaining to her how the real treatment plan's got to be based on tolerating both sides of the ambivalence. The locus of control shift will come in and I'll explain that to her real briefly. And what you'll see is that these are not just theories about what happened in childhood, that the problem of attachment to the perpetrator and the locus of control shift are dominating her thinking, her decision making, her behavior, and her feelings in the present. You'll see that we'll be dealing with some of the practical side of housing, money, legalities, and so on. And you'll see me working a little bit on educating her into and then actually practicing tolerating her ambivalence instead of just jumping to resolution in this direction, resolution in that direction, learning to sit with the whole problem and tolerate both sides of the feelings. And since this is taking place at a women's shelter, you'll see that diagnosis doesn't come into account. There's no psychiatric terminology, but it's really exactly the same problem, the same conflict, the same logical dilemma as we'd see if we were assessing somebody with borderline personality disorder at an emergency department. It's the same split, plus minus, love-hate, approach, avoid conflict. Hi, my name's Colin Ross and I work here at the shelter. And I'd like to spend maybe about 45 minutes or so with you now.
Okay.
Just kind of get to know you a little bit, get to know the situation a little bit, and then probably around 9:30 tomorrow morning, meet with you longer and also meet with your 2 kids.
Okay.
I just caught a glimpse of them going down the hall. They look like quite the bundles of energy.
Yeah, they are.
7 and 9? So I'm wondering if you could fill me in on what it was that happened immediately before you came here that led to your being here.
Well, let me just start by saying we are not going back. I promised my children, I promised myself, and we are not going back this time. For sure, I know that.
Right. And I can see with good reason because I can see the shiner that you got there. So he's hit you pretty hard this time.
But that's it. I'm not going back.
Right. It would be helpful to me, though, to understand the whole general context in a little bit more detail. If you'd just fill me in on kind of the sequence of events that led up to him beating up this time.
Same old thing. Just stupid stuff. It's always over little stuff.
What was it this time?
I didn't have dinner on the table on time.
And what was going on that got you behind schedule on dinner?
Took the kids to the park. They had a teacher's day. They didn't have to go to school. We just lost track of time. We were playing. I forgot my watch. And I just got home late. And he just lost it.
What time was it by the time you got home?
10 after 7.
And when is dinner scheduled for?
It's supposed to be on the table at 7.
Is that when he gets home or what?
Yes.
And what kind of work does he do?
He's a foreman.
Like in construction?
Yes.
So pretty busy right now?
Yes.
Does he go back to work after dinner? Or is he done for the day when he comes home at 7?
No, he goes back to work after dinner.
So a lot of job work pressure.
He works a ton of hours. He's a hard worker. He's a very hard worker. And he works many, many long hours, and those are the only moments he gets to eat, and he just gets little breaks during the day when he can come home, and And I mean, I know his blood sugar, I know all that, and I'm usually really on it, but I just forgot my watch that morning, or that afternoon, and
He has a blood sugar problem?
yeah,
Does he actually have diabetes or just a
he's borderline,
borderline?
and
And so you got behind, and therefore he got behind on getting his sugar back on
so
track
he's
and
not in
getting
a
his
good
dinner
mood
eaten.
when he comes in, and
Right.
and he needs to eat, and he only has like this little tiny window. He gets like 20 minutes he can eat because it takes 10 minutes to drive back, and
So I want to comment on something that I've noticed while you've been talking. When you first started, your tone, your language, your body language was very forceful, very clear, very adamant. You're done with this. You don't deserve it. Your kids don't deserve it. You're out of there, which was good to hear. But as you got a little further into describing what was going on, and you were talking about his blood sugar and his stress at work and construction and so on, your body language shifted, your tone of voice shifted, your posture even shifted a little bit, and you almost became apologetic.
well, I mean, I have to be fair. I mean, he does. All those things are true. He does have a really hard job, and he does work a lot of hours, and he's really tired, and I mean, he does do a lot, and he is not in the best of health, and
Right.
I mean, I'm just trying to be fair.
So those are all things that are just objectively true.
And he doesn't really ask a lot from me. I mean, I just have to.
Well, he asks for meals absolutely on schedule every single time.
Yeah, but that's really. I mean, there's not a lot, and
But the problem is not what he asked for. It's the problem is the consequences you get when you don't deliver. Namely, spousal abuse. So whether he's justified
I
in
mean, I'm
asking.
pretty much on time
Right.
with that. It didn't happen hardly ever.
But it's not necessarily completely unreasonable for a husband who's got a certain window of time, who's working construction, who's got a blood sugar problem, to want dinner on the table when he arrives home. That in and of itself is not incredibly unreasonable. But where the whole thing falls apart is when you don't deliver, the consequences, you get beaten. That's
I mean, not all the time.
enough that you've been to this shelter how many times?
I don't know.
I think I saw an intake that this is either your 7th or 8th visit here.
I think it's my 7th.
So this is not just a one-time deal. And the problem is just what I said, that you're a victim of domestic violence, spousal abuse, spousal battery, on a repeated basis. And there's nothing that you can possibly do to justify him beating you.
Well, I know, but I mean, that doesn't absolve me from my responsibilities either.
But the question is, what is it you're responsible for? Are you responsible for cooking, or are you responsible for getting beaten up?
I'm just saying, I was responsible for cooking, and I didn't.
In your mind, does that in any way justify getting beat up?
No.
You sound a little shaky on that.
I can understand why he'd be angry.
Sure. Well, I want to come back to commenting on your body language and your tone of voice and your posture and so on. The reason I was commenting on that is you shifted from what I could call mode A to mode B. So mode A would be that more forceful, adamant, confident, your spine is straight, you're not taking any more, you're done. Mode B is the more quiet, apologetic, lacking in confidence, little bit of self-blame, self-accusation.
That's just my responsibility. We're just starting talking about what my responsibility was.
Exactly. But the reason I'm commenting on the shift is, I'm thinking that this is a mini version of the shift that you go through. This is just something that's kind of theory I'm throwing out for you.
I'm not going to go back.
That's good to say, and that would inspire a person with confidence, except for the fact that this looks like it's a repeated pattern. Because I imagine all the previous 6 or 7 times that you came here, when you walked in the door, it was the same thing. That's it, I'm done, I'm out of there, I don't deserve it, the kids don't deserve it. And I think it's likely, and I'm basing this on a lot of experience, I think it's likely that this little mini shift that you've done while we've been talking, you do that shift in a bigger version from the time you walk in, saying you're in mode A, I'm out of there, I'm not going to take it anymore, I'm done. But in the previous occasions, you've gotten on some kind of slippery slope and slid back to mode B,
It'll be different this time.
which then leads you to going home.
It'll be different.
If it could be different, that would be good. Because staying in this cycle of you go back home, everything's okay, get beat up, you're back here, around, 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 is got to be incredibly demoralizing and really a lousy way to live. So we need to interrupt the cycle, no question. But the reason I'm bringing this up,
I just won't talk to him this time. That's my mistake. I just won't talk to him.
if that could work, if that was feasible, that maybe would be a plan.
Well, I know it's feasible because he'll call up here, he'll apologize, he'll start talking about when we first got married and how much he loves me and how he would, he won't do it anymore. And
So if you don't listen to all that, you don't get sucked back in
yeah, so I won't talk to him while I'm here.
for the rest of your life. Your kids are 7 and 9, and you're not going to talk to their father for the rest of your life. That's a doable plan.
Well, I just won't call while I'm here. Maybe I can get stronger.
What happens once you leave? You can't not have contact with this guy for the next 10
Well, I'll
years.
tell him we'll just talk about the kids.
And he has a track record of respecting your boundaries and going along with what you say?
Well, what do you want me to do?
What I want you to, it's not so much what I want you to do, go back, not go back. What I want you to do is start looking at the pattern and understanding the pattern you've been trapped in, because if you get a clear picture of it, then we can start working on changing it, rather than just doing the pattern over and over. That's why I was starting to comment on this shift from so-called mode A to mode B.
You don't think I should stay, do you?
If you are going to be abused one more time in the future, you should not stay. No question. I can't really have a total assessment or final opinion because I've only just met you. A large percentage of the women who come here, they just need to get out of the marriage. The guy is too far gone, too dangerous, too violent. Every once in a while there's a situation where maybe the marriage can be salvaged, maybe you get into marital counseling, if the guy gets into individual therapy, if he's got a drinking problem or whatever kind of problem, anger management, sometimes the situation can be salvaged. I don't know for sure that that's impossible in your marriage.
So you think I should stay?
I honestly don't have an opinion one way or
My
another.
mother said he would kill me if this happens again. That's what she's afraid of.
If the risk of him literally killing you is high enough, then there's no way you should go back.
But this isn't okay either.
Absolutely
I mean,
not.
this didn't kill me, but
All I'm saying is right at this moment, before the next few days, week, I'll have a pretty solid opinion for you. I just don't have one now because we've only just met. So it wouldn't be fair just to give you a snap decision, here's what I think you would do, or should do. I mean, it's just not fair to you. I need
nobody's ever talked to me about staying.
Well, but in fact, you have repeatedly stayed.
Yeah, but
So
everybody tells me to leave.
But everybody telling you to leave has actually been part of a pattern that's resulted in staying. So not talking to you about staying hasn't worked. Not talking, it seems backwards, but not talking to you about staying has been part of a pattern where in fact you've continued to stay. So just saying leave, 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 the actual outcome has been stay, 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 stay. So what I'm thinking is we need to, it's a matter of looking at both sides. All the reasons to leave and all the reasons to stay. Because if you just go, if you're in that mode A and mode B doesn't exist, I'm out of there, it's bad, I don't deserve it, my kids don't deserve it, all those things are true.
Right.
But you're not paying attention to all the other half of reality that keeps sucking you back all the time. Pretending it doesn't exist, or you're not going to talk about it, or you're not going to think about it, hasn't worked.
What's that reality?
All the reasons to go back. Where you start softening and you start saying, well, you know, he's really under a lot of stress, and he's got his blood sugar, and he's the father of my kids, and
And he's a good father. I mean, he's really a good father. He loves his kids.
But
He's really a good father.
The more you start looking at all the reasons to go back, I'm guessing the more that little note of self-blame starts to creep in. And then you're no longer in mode A, you're in mode B. Oh, it makes sense to go back because he's under stress, he's a good person. All he wanted was dinner on the table, I didn't deliver, it's kind of my fault. I'll go back, I'll make sure I don't mess up again, and things will be okay. All of that leads you back to the home. And then on previous occasions, when you get home from the shelter here, what happens? What's it like when you arrive back home?
He's really sweet.
And so you get some extra this, that, and the other?
He's very nice, very affectionate, very sweet, very loving.
How long does that last for?
Different amounts.
From days to weeks, months, just kind of?
It's lasted over a year.
What's the shortest amount of time it's lasted? What's the shortest interval between leaving the shelter and being back at the shelter?
Probably a couple of months.
Right. So everything is great for a period of time. But then you get beat again, you're back here. So when you go back, and you're thinking, here's all the reasons why it makes sense to go back, and you do actually go back, and you work on being a better wife, better mother, better housemaker, homemaker, then he rewards you with good behavior. And your conclusion that you should go back and try harder gets proven to be true. Because you try harder, he's nice, you feel better,
Well, I
he
think
feels
he feels
better.
guilty too.
Sure, but after a while all that wears off.
Well, maybe I can do something to make it stay.
Something like what?
Pay better I don't know. Just be.
What is it?
Pay more attention to time and be more responsible.
Okay. Sure. For a while.
So I just need to learn how to maintain that.
Okay. So your basic sort of model or theory that you're operating on here is he's under stress, he's got this, that, and the other, and the reasons that he's beating you are mostly because your performance is not good enough. If you could get your performance up, then despite his stress and despite his blood sugar and despite other things, he wouldn't have to hit you because there would be nothing to hit you for. So it's really
That doesn't sound right though, does it?
That's what you're saying. That's what you just said.
Do you think that's bad?
I think it's inaccurate. I would say it's bad. I just say it's an inaccurate evaluation of what's going on.
But it's always something that I really did mess up on that trips it off.
Sure. I understand that. But that doesn't mean that you're causing it or it's your fault. If every wife / mother who fails to be imperfect got beaten for failing to be imperfect, every single person on the planet would be getting beaten. There's nobody who delivers perfection.
You know, I've only have a high school diploma.
So if you were to separate from him, there'd be a big question mark about finances.
Yeah, I'd probably have to move back home.
Where are your parents near here? How far away are they?
They're about 60 miles.
So you and the kids would have to move out of the house, they'd have to change school districts, they would be torn away from all their friends, they wouldn't see their dad as much. Yeah.
And the worst thing is I'd have to live with my parents.
What are your... So that's a big price for you and the kids to pay. What is it that would... You obviously are not too thrilled about the idea of living with your parents. Tell me a little bit about that.
My dad, I mean, he's just a total alcoholic, rager, crazy.
Has he been like that since you were a little kid?
Mm-hmm.
It said in the intake material, I think you have one sister who's older, a couple of years older. So it's just the two of you there and mom and dad. And your mom and dad are biological parents of both of you? So tell me a little bit about when you're, say, 6, 8, 10.
And he'd come home drunk.
He'd come home drunk? And would he be, you said he's a rager, so was he sometimes happy, or was he always kind of angry, or just very, or?
He was sometimes happy.
And sometimes pretty violent?
Mm-hmm.
Would he beat you
No.
physically? How about your mom?
Mm-hmm.
Your sister?
Mm-mm.
Just your mom?
We
So,
would-
go ahead, sorry.
We would hide
Where would you hide?
in our closet.
And then what would be going on? I imagine you would be hearing something.
Mm-hmm.
What would you be hearing?
Just things being thrown and screaming and crying and.
Did he ever, like, leave bruises on her that you could see?
Mm-hmm.
Any broken bones ever?
Probably, but she would never go to the emergency room. No, he did dislocate her shoulder one time.
Any cuts where you would see her bleeding?
Mm. I don't remember. Yeah, her nose would bleed, but I don't remember her getting cut.
So bloody nose and some shiner ever?
Mm-hmm.
And did you see, like, bruises on her arms and stuff ever?
Mm-hmm.
So it's pretty thorough beating.
Mm-hmm.
And
it
then
would be,
what-
it was always when he was drunk. He was a total alcoholic, rager. It was always when he was drunk.
And how would it end?
Who knows? He'd get tired, or he'd pass out, or
How would you and your sister know to come out of the closet?
we'd wait for it to get. Well, we'd wait for our mother to come tell us it was okay.
Oh, okay. Was there anything that you would ever do to try and prevent your dad from blowing up and having a rage?
Oh gosh. Well, I mean, we're just little kids. What can you do? But
Sometimes kids try to do
he
something.
didn't want kids. The whole thing is he never wanted kids. My mother wanted the kids, and we had to pretty much get the house to where it appeared that no children existed. So, no toys or anything out.
So if it was near time for him to come home, would you tidy up then?
Oh gosh, we would, like, in a little frenzy, we would clean everything up and make sure the remote was on the table by his chair, because if he came home and so drunk and stupid he couldn't find the remote, and one time he just went crazy and it was like in the chair, but he couldn't find it. So we made sure it was right where it needed to be, and everything was cleaned up, and we were in our room. We were pretty much in the closet from when he came home, because we never knew what was going to come home.
Well, I can see why you wouldn't be wanting to move back in with your parents.
No, they're
That's
still
just-
married.
Be jumping from the frying pan into the fire.
No, I mean, my husband's an alcoholic.
Right. I see that
My
there's...
dad was a horrible father. He hated us.
Right.
He didn't want us. He made that very clear. My children's father loves them, and they know he loves them, and he's not an alcoholic. He doesn't drink at all. He doesn't drink at all. That's why I married him, is he doesn't drink at all.
Okay, so there's some clear differences between your husband and your father.
Yeah.
One difference is your father's a raging alcoholic, your husband doesn't drink. Another difference is your father's like 20 or 30 years older than your husband, right?
And another big one is my husband wanted our children and loves our
Right.
children and is good to our children.
Right, so your husband's a much better father than your father was.
My father wasn't even a father.
Plus, another difference is your husband is your husband, your father is your father. I mean, they're clearly separate
well, duh,
people.
Yeah.
Right, so there's many clear differences between the two. They're not like photocopies of each other or something.
Well, right.
Right. So it's good to be very clear on the differences. And it sounds like your kids are lucky to have definitely a better mom and also a better dad than you had.
Right.
So you've done a lot to make sure that the trauma and abuse and neglect and chaos that you experienced doesn't all get passed on to the next generation.
Right.
Which is 4 happy
that's-
faces and 5 stars to you as a parent. That's excellent.
I wanted out of the house because it was so bad.
Okay, now what I want to emphasize is the similarities. We're very clear on the differences, but I want to look at the similarities. Because the pattern, it's more the pattern. It's not the facts so much, it's the pattern. And the pattern that you were in as a child, that you've just described, is you're in the home, life is going on, and then the violent rager blows up. And you and your sister are gone. You're hiding in the safe place, which is the closet. Then when everything's settled down, you come back out and you remind yourself this lesson that you've learned over and over. You have to be really sure to be quiet, not to have a mess, have the remote in the right place. So you are trying to do things to calm him down, to placate him, to be a good little girl, to reduce the chance of him blowing up. But it may work a little bit for a little while, but in the end he blows up again. Then you're back in the closet again, then you're back out, and around it goes. The similarity between that and the present is, you're at home, instead of at home with your father, you're at home with your husband. Your sister isn't living there. But when it blows up and there's a violent rage episode, instead of taking off to the closet, you take off to the shelter. Then everything's kind of calm, which is where you should come. I'm just looking at the pattern. So when you hide in the closet, it was the shelter for a while, things calm down. Then you figure, okay, if I go back home and I have the remote in the right place, if I don't have the toys, well, except now it's not remote and toys, now it's cooking well enough, cleaning well enough, taking care of the kids well enough. If you can do something, that'll reduce the odds that he'll blow up in the future. So the pattern is very similar. The details are different. It's your father, then it's your husband. There's alcohol, there isn't alcohol. It's the shelter, it's the closet. So when you don't look at the details and you look at the pattern, it's the pattern that's similar. Does that make sense?
Yeah, I mean, I guess.
What about it doesn't seem to make sense?
I mean, I just never looked at it like that.
But now that you are looking at it that way, does that seem accurate? Does that seem like a reasonable summary?
I mean, I guess.
Okay. You seem a little doubtful. I'm very clear that there's major differences comparing the present situation to the past. But I really want to ignore the differences for a minute, focus on the similarities. Because the problem that when you're just a little person, 4, 5, 6, 8, you're really trapped in the situation. You can't run away from home, go live on the street.
That's what feels different, is I chose to come here. I didn't feel like I had choices.
Well, you chose to run to the closet. But you were trapped in the overall situation. Here, at least in theory, you have the option of divorce. But you couldn't divorce your parents when you're 6.
Right.
You were stuck there.
Right.
And so it was just around and around and around and around. And what you developed was what any child in that situation would develop, which we call the problem of attachment to the perpetrator. And that is, the most important people in your life for any child are their mom and their dad. And you bond to your mom and dad, you form a connection with them, you're attached to them, basically because you're a mammal. That's what mammals do. And in the normal course of events, mom and dad are pretty stable, pretty okay. They love you, you're special in their eyes. They do what they can to protect you and nurture you, and it all kind of works out okay. And you can be in this kind of I'm okay, you're okay mode with your parents. But in a home like yours, the people who are the most important, safest people in the world are also the most dangerous, frightening people in the world. Here, your dad, your mom was relatively okay. So you're trying to form a bond and attachment to your dad, which you do simply because he's your dad, which all mammals do. At the same time, you're trying to run away, hide, you're frightened, and you want him out of your world, and the only way to be safe is to be hiding as far away as possible, which is in the closet. So you got this bind. You're trying to be connected and attached and loving, and you're trying to be as far away as possible. You're hating him, you're scared, you're frightened, you're shutting down, you're avoiding him. But then you go back into the attachment mode, you come out of the closet, everything's okay, and then you try and do what you can to calm him down, to be a good little girl. Everything's all right for a while, boom, you're back in the closet. So you have this conflicted attachment. On, off, approach, avoid, love, hate.
So
You got into this pattern because you were trapped in it as a child. The problem in the present is you're basically in the same pattern with your husband. You're bonded to him, you're attached to him,
Right.
you're connected to him. He's the father of your children.
and he's a good father.
He's a good father. He works, he provides for you. You're living in many ways in a better environment now than if you were to move back in with your parents. But the person who earns money, puts a roof over your head, helps parent your children is also the most dangerous person in your life who might actually kill you. So you've got this same double bind, conflicted attachment with your husband. You're going back to him, you're loving him, you're connecting to him, you're running away from him, you're fearing him, you're hating him, you're back to being with him. It's the same conflicted problem of attachment to the perpetrator, because the perpetrator in the present is your husband who you also love. And when you just focus on the I hate him, I'm out of there, that's true, but it's only half of reality. then when the other half of reality starts to take over, it sucks you back in to trying again. And that half is also exists, and it's real, and it's true. In many ways, he's a good father.
There's like two sides.
If you don't learn to feel, look at, consider, balance the two sides, you're just going to be stuck in the pattern like you were as a kid.
But that's what, if I look at both sides, I'll never decide anything. What will I do? I'll just be stuck. There's always two sides. I have to decide one side or the other side. Which one am I going to go with?
But by trying to decide without looking at both sides, the net outcome has been no decision so far. What's actually happened so far is you've tried to just look at one side, but actually you've been back and forth and back and forth and back and forth. So the just look at, I gotta leave and here's the reasons, hasn't been working. It's learning to tolerate that ambivalence and learning to deal with some of the basically underlying grief of your husband's not the guy you married and you don't have the marriage you dreamed that you would have, that you deserve. There's a lot of sadness and grief underneath about all that. Learning to tolerate that, stepping out of the self-blame so that you're not explaining in terms of, I'm a bad wife, I didn't meet the standard here, I didn't meet the standard there. If I improved my performance, if I fix myself, then everything will be fine. So it's shifting out of the self-blame. It's learning to tolerate that he is abusing you, he is good to the kids. You do love him, you do hate him. You do want to be divorced, you don't want to be divorced. Until you can tolerate all of that, you can't have a balanced plan that's based on both realities. Because what you need to do one of two things. Just going through this cycle over and over and over is intolerable. You either need to separate, get divorced, and stay divorced, or you need to get back into the marriage, but start having some consistent boundaries and some rules and some consequences. This cannot happen anymore. I'm serious about it. I've got the resources to back myself up. You've got to do this and this and this, and really stick with it. Get out of the self-blame and get more to, this is your problem.
How do I stick with it? I can't make him.
That's going to require a bunch of work with a therapist.
From me or him?
You need to work with a therapist no matter what, to get yourself out of this pattern. He needs to work with a therapist, I'm sure. I've never met the guy, but I'm sure, because he's got rage problems, every single batterer needs therapy. If he won't go for individual therapy.
I don't think he'll go for therapy.
If he won't go for marital therapy, if he won't acknowledge his behavior, if he won't take responsibility for it, those are all bad signs for the marriage lasting. But like I said, I don't have a final conclusion right now.
But do you think I should stay or do you think I should leave?
We're gonna talk about this a bunch over the next few days, weeks. Stay or not stay. But like I said, right now I don't have a final opinion. The more comments you make, the more it's kind of tilting away from staying. But we've got to look at what has drawn you back all those previous times. Just in terms of the self-blame part of this, we have a term for that too, which is called the locus of control shift. We just use that in our treatment model here. And it's really the self-blame that children get into automatically, because kids always think they're at the center of everything. Everything revolves around them, and they're the cause of everything in the world.
Well, my dad always said, y'all are a bunch of stupid idiots. I wish I'd never had you.
So then the behavior and also the statements of the parents can reinforce the idea that everything is because of the kids. And so you end up blaming yourself for all this abuse and chaos and violence. And the conclusion you reach as a kid, just automatically, because kids think this way, the conclusion is, I'm bad, I don't deserve better, it's my fault, he's doing it because I deserve it. And so that self-blame gets very deeply ingrained. 20, 30 years later, you're explaining to me how your husband beating you up is partly your fault. It's not true, it never was true. So a lot of the work of therapy is digging yourself out of that pattern of self-blame. I think what happened as a child set you up to be in that pattern. And then when your husband stepped in and took the role of the battering male in the house, that just reinforced the pattern and helped trap you in it even deeper.
Because I thought you were supposed to not... I don't know about talking about all this stuff from my childhood. I thought you were supposed to just work on what's going on now. I don't really understand how my childhood...
Well...
Because the problem's now.
That's a very good question. And I absolutely agree that the emphasis is on the problem now. And it's not that you have to go back and rehash your childhood, for 20 years of therapy sort of thing. But understanding how you got into the pattern and understanding that a lot of the feelings are present day feelings on top of childhood feelings just gives you a better kind of map of how you got into this mess, why you're stuck in this mess. Getting out of it, you can only do in the present and the future. So if you're talking about your husband, you're talking about the problem of attachment to the perpetrator in your marriage, all the unresolved feelings from childhood will kind of be tagged along, and you can resolve them all by talking about the present. So most of the conversation can be about the present. We just have to keep kind of a mental flag that, hey, a lot of this is about mom and dad too. And then you can kind of process both together, basically.
I just don't know. I don't know what to do.
Stay here. Don't leave.
Don't
Work with
talk
us.
to him.
Well, not for the next 24 hours, that's for sure. Now, whether we want to, and we're not going to decide this right now, whether we want to contact him, send him any messages, communicate with him in any way, we'll figure that out. But until we figure that out, yeah, don't talk to him, don't communicate with him, stay here, keep yourself safe, keep your kids safe, and let's get to work. So right now, what to do is don't do anything, just stay here. You don't need to decide anything about where you're going to live for today or tomorrow or the day after. You're going to live here. That's the best decision.
But I mean, I don't know what to do about whether to
Don't try and make that decision right now. It's all a process. Roll up your sleeves, get to work, we'll think about it, we'll talk about it, we'll look at both sides, we'll go back and forth. It's painful and difficult, it's not simple. If it was so simple, you already would have decided. And we have a little bit of reading material we can give you that goes over some of this, and we have some groups where we go over it and explain it and talk about it.
Okay.
And then, like I said, roughly about 9:30 tomorrow, I want to meet with you again a little bit, and then talk to the kids a bit, and then we'll take it from there.
They love him.
And that's going to make the whole process much more painful and difficult for them and you. Because if he was just totally evil and everybody hated him and nobody had any love for him at all, it'd be simple. You know what to do, and you just go ahead and do it.
Yeah, Janet, her kids hate him. He's mean all the time, and she still wants to go back. I mean, that doesn't make sense to me at all.
Well, you know what? There's two kind of problems. It's like reality split in half. So when the kids just hate their dad, what I really want to tap into is underneath that they love their dad. When
But they don't. He's mean all the time. He's not nice to them.
They're mammals. They're biologically connected to their biological father.
They want him to love them.
Yeah.
I'd say that.
Right, exactly. So they need and want their dad, but he's not the dad that they need and want. That's
right.
the bind.
So they've stopped loving him.
You just cannot squish it all the way down to zero. It's just a basic blood
It seems
bond.
like to me it'd be easier if he was mean all the time to leave.
It would. But even if he's mean all the time, it doesn't reduce the love to zero. For Janet, what I would want her to tap into, she's all into, I love him, I want to go back to him. She needs to tap into all the anger and resentment and hatred she has for him. She's too much over on the other side.
Yeah.
So it's all about balance. And the thing that's so painful about it is both realities are true. That's why it's tough. It's tough emotionally and tough to decide what to do. So, like I said, we'll be focusing on kind of two aspects of this. Just the practical, money, housing, finances, your rights, legal side of things. We'll do a whole lot on that. But a big part of figuring out what to do and having a workable plan is dealing with the emotion part of it. And so we'll be balancing both. So, just in closing, I think you absolutely made the right decision by coming here, and I'm glad that you are here, and we'll get to work on this. I look forward to meeting your kids tomorrow.
Thanks.
You're welcome.